So I will talk more about the COVID experience in the United States. So as was mentioned, as shown on the website, and we talked very briefly in the beginning, I'm a public health veterinarian by training. I also have a PhD in worker safety and health from the Center for One Health Research in the University of Washington in Seattle. So I'm a true One Health champion, and this is definitely a One Health issue. So really interested and excited to present to you guys today. On this topic, I currently work as a director, producer, and public health at the National Pork Board. I've been in that position since 2017, so I oversee the research as it relates to public health topics very broadly, including worker safety and health, food safety, etc. So really been following this issue as it relates to our pork producers and what it means for them, especially from a continuity of business perspective in their workforce. So I've outlined the talk really to, again, cover COVID-19 in the US, go through some of the specifics, talk briefly about COVID-19 in animals as well as disease prevention. So as Dr. Roy mentioned, the picture is rapidly changing. Johns Hopkins has some great resources, but for my presentation, definitely want to drive you to some of those resources, and we'll make sure that the slides are available after the call, and these hyperlinks and this credit line at the bottom of each slide, you'll see really provide some information and references to everything I'm showing you today. So in the United States, you'll see some discrepancies in the number of cases. This number was pulled from the Centers for Disease Control and Prevention, but as we have more and more labs locally that are doing their own testing, we'll see some of those discrepancies. And the CDC says, you know, definitely trust your state or local health department to have that information. They do, however, continue to share updates as they know that they are a trusted resource of this information. They have this nice heat map on their website that shows the different states, different caseloads, but they also have it built in. They have hyperlinks, excuse me, built in so that you can click on your state and learn more about it. So I'm located here in New Jersey, and that would route me directly to my health department. So it's important to point out, however, as we talk about the number of cases, the majority of those are under investigation in terms of what categories do they fall into: community spread, travel associated contact, or close contact, and some of those are tests that are pending. Again, really want to make it clear to folks that are watching that the CDC has tons of guidance on their website for all different situations and issues that you may have. So if you can see here, they have travel guidance for at-risk populations, all the different areas. And again, this links you here. Ultimately, you can Google COVID-19 and CDC, and it'll take you to their landing page, which will allow you to kind of click through and get the information you need. So what you've been hearing a lot lately is this focus on at-risk or higher risk or vulnerable populations. Unlike most infectious diseases, when we think of the yuppies or the young, the old, the pregnant, the immunocompromised, what we've seen so far at least, and keep in mind, as Dr. Roy mentioned, a lot of what we know about COVID-19 comes from the data we got from China. They've had over 40,000 cases in a period of 2 months. This comes from a publication that was posted in February, or published in February, excuse me, that just shows the distribution of the ages of individuals and the proportion of folks that died as a result of their cases or their illness, excuse me. So the blue bars here represent the proportion that fell in a given age group, and the orange represent the proportion of folks that died as a result. So you can see as you get to that 60 plus range, you have really tall bars, the highest being in those over 80 years old. Additionally, in that publication, they looked at other underlying conditions that these cases had, especially the ones with severe disease and or that related in death, and noticed some secondary chronic chronic conditions that these individuals had, suggesting an immunocompromised state. So again, as we continue to see more cases, we're in the tens of thousands right now in the United States, we'll continue to learn more about the virus in the US population and what it means. There's also been some talk of, just in terms of the proportion of cases in, say, the 20 to 30 range, we suspect that we might see some different distributions there. There's lately been a lot of conversations around mass gatherings, so just social events, places where lots of people come together. I mentioned that CDC has guidance on numerous topics that includes mass gatherings. Keep in mind that these are interim guidances on the different topics, so it really is a living document. And what you really see as it relates to those mass gatherings, if you were watching this a couple weeks ago, you could see this document change and evolve. And the CDC has done a great job of really highlighting what those changes are in that document as they make those updates. So initially, they really focused on preparedness for our organizers, how to plan for COVID-19, what things to put in place, hand washings, hand sanitizers, etc., what to do if you identify someone during the event, etc. They also then started to highlight those vulnerable populations as that data became available. And then just, a week or so ago, they made the recommendation to reduce that number. So if you have it was initially 250, then it dropped down to 50 people or more. They said go ahead and cancel or postpone those events for at least 8 weeks. And the goal there is to flatten the curve, though we've heard more and more of, especially coming out of the White House, and I have links below again, trying to reduce that number even further to fewer people together gathering as possible. I provide a link here to the flattening the curve graphic. I think a lot of folks are familiar with it now. It shows essentially two different outbreak or epidemic curves. The first one is very tall, right? And there's this focus on that healthcare system capacity. So if it's too tall, we will not be able to fully meet the needs of those individuals with severe disease, whether it's from a number of beds, hospital space, or ventilators issue or metric. We're really trying to make sure that we, by flattening this curve, that everyone gets the care that they need, especially those with severe diseases. If the scientific jargon doesn't meet your needs, there's been some fun memes that have gone around that use different terms that mean a little bit more than other folks, and I find this cat one both funny and accurate. Well, some of the questions I get from producers, especially as we're starting to see in response to this goal of flattening the curve and reducing those mass gatherings, a number of states, I'm going to say Illinois, California, New York, I live in New Jersey, we implemented a stay-at-home executive order, or excuse me, the governor implemented a stay-at-home executive order over the weekend. Ohio has one that'll go into effect probably by the end of the day today. And so there's been this comment around essential or non-essential businesses having to close, again, with that goal of flattening the curve. And so I do want to make it clear, the cybersecurity, information security, and the CISA, I forget entirely what that stands for, but it's around cybersecurity and other information security infrastructure, provide some guidance on essential workers. And so there's a comment on that critical infrastructure. So I show this figure here to show you what those different areas are. So regardless if we're talking natural disaster or pandemic, we need to make sure that these places are still open and functioning to serve the needs of the American public. So food and agriculture is listed as one of those critical areas, and there's a specific call out to animal agriculture. What we are seeing is, some of the small animal veterinarians aren't specifically called out in these areas. Things like different areas might also be listed or can be listed, state-specific rules that are going out. So a quick comment about disinfectants as it relates to COVID-19, as I know this is a question I've gotten quite a lot. Are there any veterinary disinfectants that are effective against COVID-19? Well, that depends. EPA has a list of the effective disinfectants, and again, provide the links below. American Chemistry Council also has a list of disinfectants that are effective against COVID-19. But again, remember that we're talking about a human disease, and so we need to look at those disinfectants that have a human coronavirus claim. What I can tell you, having looked at that list, the categories in terms of the broad categories that are different disinfectants, including veterinary disinfectants, fall into are some of the same ones that we use commonly in the veterinary community. In addition, the National Pork Board has funded research, in the past that looked specifically at swine coronaviruses. And to be completely clear, swine coronaviruses only affect pigs. And those are things like PEDV, TGEV, which are both alpha coronaviruses. And then as the name suggests with porcine delta coronavirus, that's a delta coronavirus. Again, those are viruses of swine. Do not confuse those with COVID-19 or SARS-CoV, which we are currently talking about with this outbreak. With that said, we have done work that suggests that there are disinfectants in the veterinary community that work for swine-specific ones. Not necessarily, I don't necessarily encourage you to assume that they would work, but just know that we have ones that work in our area for veterinary drugs, but none of them right now have claims for human coronavirus strains. Which brings me on to the next topic, which is COVID-19 in animals. And again, just want to clarify, as Dr. Roy mentioned, likely originated from bats. So this outbreak likely originated from bats. There's some speculation of an intermediate animal host, such as the pangolin, but there's no evidence that suggests that pets or other domestic species, including our livestock, have played any role in the transmission of this disease. Additionally, we haven't had any cases here in the United States of pets, wildlife, again, those domestic animal species, including our livestock, pigs, cattle, poultry, etc., that have tested positive here in the United States. With that said, there's been a number of cases of dogs that had tested weak positive in Hong Kong that were tested, whose owners had a COVID-19. Neither case was symptomatic. But these animals were tested anyway with a test that looked specifically for virus RNA, right? So it was looking at to pick up pieces of that genome that we talked about that consists of the virus, or excuse me, that the virus consists of, so not necessarily looking for true disease and true infection. And then as I mentioned, there's been no instances. We haven't tested any animals here in the United States, and the public health community, especially our state public health veterinarians, are working to develop protocols on when should we test these animals, when is it appropriate, and how can we interpret those results. So again, wanted to make that completely clear. Additionally, there's no evidence to suggest that this disease can be transmitted via food or food packaging, so it is not considered a foodborne disease. Out of an abundance of caution, however, the CDC does have guidelines. It's on their website here. The USDA and the FAO have comments around that foodborne comment that I just made, so it's not a foodborne disease. They have that directly listed on their webpage. And again, the CDC has recommendations out of caution to help prevent potential spread to animals if such in a situation were to occur. So as it relates to disease prevention, so my last couple of slides are really just how to prevent disease. And as it relates to COVID-19, it's no different than any other respiratory disease. We want folks to wash their hands after touching contaminated surfaces. Wash your hands for at least 20 seconds with soap and water. You can additionally use hand sanitizer that's at least 60% alcohol. You want to avoid touching your face. Stay home if you're sick or if you've been to somewhere with an increased risk. Additionally, we want you to seek medical care. The CDC has this great symptom checker that I've linked to here in the slide. Definitely seek medical care if you have those common signs and symptoms related to this disease or have been identified related to this disease, including fever, cough, and shortness of breath. We do encourage you, however, to call ahead. Don't necessarily run directly into the doctor's office. We don't want you sitting and lingering in doctor's offices, maybe exposing others, or if you don't have it and someone there has it, you could potentially expose yourself. So definitely call ahead and seek additional guidance from your healthcare provider as to what the next steps are. If you do test positive, I want to drive home, we quarantine the exposed, we isolate the sick. So isolate yourself, especially if you have mild disease, you need to stay in the hospital. Separate yourself from others in the household. Other household members may consider self-quarantining for 14 days. Limit your contact with pets and other animals. And again, work with your local public health officials and public health veterinarians to understand next steps. Finally, in terms of employee safety and continuity of business, we encourage folks to make sure that they have a safety plan or COVID-19 plan in place. We at the National Pork Board created pork.org/COVID-19 that provides direction on direction and resources for our producers that are trying to learn more about this condition. Additionally, we want folks to revisit their sick leave policy and keep in mind those external factors. Sure, maybe your workforce is healthy, but then the schools close around your area, you have a stay-at-home order. What does that mean for you? So be prepared to revise and update those plans as needed. And so just to reference back to that flattening the curve that we talked about before, we really want to practice social distancing, my goodness, on the farm whenever possible. So that means spreading out the workforce, and I believe Dr. Bender will cover this in a little bit more detail, but just want to drive home, reinforce, and again, I provide that link at the end. So again, Pork Board, we have resources available on our website, mostly directing folks to the CDC or Johns Hopkins, but we do have some swine-specific references there that we encourage you to check out. Also, reach out to your specific commodity group, whether you're with soybeans or cattlemen's, etc. They might have some additional resources that are specific to you. Again, these are other links. They'll all be live. I did include some additional content, including a glossary that helps orient you. Again, Dr. Roy presented a nice table that compared the different viruses. These are all coronaviruses. Influenza is not a coronavirus, but really just compares those respiratory viruses, puts it into context, and then the glossary helps orient you on the different metrics they provide there, and then a comment on COVID-19 as it relates to travel.